Good morning, Mrs. Pooter.
Good morning.
I'm Elizabeth Wilkinson. I'm a nurse practitioner student. Is it okay if I see you today?
Yes.
Okay. So we're here to check on your little baby. Is he 2 days old now?
Yes.
Okay, and how is he doing?
He's doing well.
Wonderful. So what brings you in today?
Well, I was having some concerns about breastfeeding because he's not latching very well.
Okay.
Also, he looks a little yellow.
He looks a little yellow. Okay. What kind of breastfeeding problems are you having?
He's just not latching well. It doesn't seem like he can get his tongue all the way out.
Okay. All right. So I have some questions about your delivery. How many weeks was he when he was born?
40.
40 weeks. Okay. And how much did he weigh?
6 pounds, 7 ounces.
Okay. Just full term. Any problems at all with the delivery?
No.
Okay. And has he been given any medications?
No.
Okay. And have you had any other issues or problems? Is he wetting any diapers yet?
Yes. But he only pees about once a day.
Okay. So he's peeing about once a day. So ideally, during the first day of life, we want them to start peeing once a day. By 2 days of life, 2. By 3 days of life, 3. And then after that, we want at least 4 to 6 a day. So he's on the lower end of normal. It could be related to milk transfer if you're having some issues with breastfeeding. Are you feeding the baby with any other methods, from a bottle or with formula?
No.
Okay. I'm sorry, your husband had mentioned that you were also bottle feeding as well.
Oh, yeah, I'm sorry. I took that question literally. Yes, my husband's been bottle feeding him, yes.
Okay.
I typically only feed him from the breast.
Okay, all right. And how is he taking milk from the bottle?
Well, actually.
Okay, all right. So what is his activity and energy level like? Is he sleeping? Is he too drowsy to wake up?
No, it seems like his activity's good.
He's good. Okay, so how many hours is he sleeping?
At any given time?
Mm-hmm.
Maybe, I don't know, 45 minutes to 2 hours.
Okay. And when he, does he wake up from these naps on his own? Is he alert and sort of looking around to...
Yes.
Okay. And not having any issues with him being very drowsy or difficult to wake him up to
No.
feed? Okay. All right. And did they do any sort of procedures on him after he was born? Any family history of anything we should be aware of, like heart disease or diabetes, thyroid problems,
No.
asthma? Okay. And anyone smoke in the household?
No.
And where is he sleeping at night? Is he sleeping with you in a crib?
He's sleeping in a crib.
In a crib. And what position does he like to sleep in?
Oh, we put him on his back.
Okay. All right. All right. Very good. So what we're going to do is we're going to run a couple tests. The first one is a transcutaneous bili. So I can see here from looking at your baby that there is some jaundice. What you can do is if we just simply touch the skin there, we can see it blanch and the level of jaundice or yellowing in the skin. And I can see that it's down on the face to the nose, the chin, and a little bit, not quite on the chest, okay? If you notice the yellowing going down below the nipple line here on the chest, that's a sign of the jaundice progressing and getting worse rather than better. Right now, during the first, since it's day 2, by day 3, usually the bilirubin levels are at their highest, and then towards the end of the week they should start declining. As long as baby's getting enough milk to drink and eat, and he's passing stools, then he'll be able to help rid his body of the bilirubin, and the bilirubin level should get better if there's no trauma in birth and no metabolic problems or issues. Did they take a blood sample when the baby was born to run a screen?
Yes.
Okay, so we'll take a look at the results as well and make sure that there's nothing else worrisome going on to contribute to this. Otherwise, extra sunlight, if you have a chance throughout the day, try to sit near an open window so you can get some indirect sunlight on the baby. The sunlight helps the body metabolize the bilirubin as well. So we're going to do a quick exam on him as we'll listen to his heart and lungs. Yes, your eyes. You're very handsome.
Thank you.
Okay. His heart and lungs sound very good. And let's take a look inside his mouth here. Okay, and I can see what you're saying. So the tongue appears tied down. He's not able to protrude his tongue out below the level of his gums. So that can make breastfeeding quite challenging. The baby needs to use the tongue to protrude into the breast tissue and massage the milk out. Have you seen a lactation consultant yet?
No.
Okay, we have one here in our office. I would recommend trying to get an appointment to see her. She's very good and can help you learn out how to position the baby and improve the latch. Medically, what I would recommend is considering what we call a frenotomy. Because of the baby's tongue being tied, there are different degrees. This seems pretty significant because the baby can't protrude the tongue at all past the gum line. And what we would do is we would take, it's an outpatient procedure. We could do it here in the office today. We simply use sterile scissors and we cut the frenulum to release it. And then we give you an ointment to help the tissue. It's a very thin tissue membrane to stay open, to create a larger margin for the tongue to protrude. And then you're going to work with a lactation consultant to help teach your baby to start utilizing the tongue for a deeper latch. Is that something you might be interested in doing today?
Yes.
Okay. There are a few risks associated with that. There's some mild pain, but it is temporary. We can do a Benocaine gel, or at home you can use ice to help reduce the pain and inflammation. We also have oil of clove, which helps the pain as well, and then we have a sugar pacifier, and if needed, you can also give Tylenol if you're really noticing a lot of discomfort in your little one, and we can give you the dosage for that as well. Other benefits of the procedure is that later in life they have found that children with a tongue tied to this degree may sometimes develop orthodontia problems, where we would refer you to an oral surgeon to assess. But it's been known to prevent malocclusions and damage to the teeth development as well. So are you sure that's still something you'd be interested in doing? Okay. All right, so we'll do that. I have one additional test where we're going to look at the transcutaneous bilirubin test. It's just with a light. It's non-invasive. We just simply touch it here to your baby's forehead. Okay, and then to the chest. All right, and then I look at our graph here. And for day 2 at 24 hours of life, the value is 10. The normal range is from 8 to 10. Above 12 is a critical value, so since it's below 12, it's not critical, but there is some jaundice, so we're going to keep our eye on it. I'm going to recommend that you come back and see us in 1 to 2 days so we can reassess that and make sure the bilirubin levels are coming back down instead of up. Okay?
Okay.
All right. So we'll schedule that procedure for the next hour. I'm also going to recommend vaccinations. We're going to schedule you for an appointment for 2 weeks out to start your vaccination series. like to give hepatitis B at birth. It hasn't been given yet, so we'd like to do it as soon as possible. We could do that even today, if you'd like. And then give the second round at 2 months. And at the 2-month visit, you'll also receive vaccinations for rotavirus, tetanus, diphtheria, and pertussis, the Haemophilus, influenza virus, pneumococcal, and an inactivated polio vaccine. So here's information on this as well, so that you can be prepared to make your decisions for that 2-month visit. And I strongly encourage you to at least do the hepatitis B vaccine before you go home today.
Let's do that.
Okay, so I'll bring you our consents for the procedures. And do you have any other questions?
No, I don't.
Okay, well, it's very nice meeting you. And your little one, what's his name?
His name is Hoot.
Little Hoot. We have a wonderful little baby. I know I focused on the problems you were discussing today, but otherwise he looks very healthy and thriving. His weight is within normal range. He's in the 50th percentile for weight and the 25th percentile for height, but you and your husband as well are 5 feet tall, and so that aligns and is consistent. And he's born at full term, and he looks just absolutely healthy and thriving. And I can see that you guys have a very special bond the way he's looking at you. Very comfortable in your arms. The other thing that we can do for his comfort during the procedures, we can do a nice swaddle for his safety, and it'll also help reduce pain. Okay.
All right. Thank you very
You're
much.
very welcome.
Thank you, about 5 feet